let's talk about the treatment when it comes to, once I know all these things, we come up with a plan. We talk about supplements. Antioxidants is really good. You know, we give vitamin C, D, and zinc. Glutathione can also help decrease homocysteine level if the L-methylfolate is not doing it. Of course, looking at the labs, we can determine, should we give them folate or L-methylfolate, or should we give them B12 or a methylated B12? Okay. So genetic testing, this can help us guide or help us predict what medicines to give, what meds to avoid, you know, less shot in the dark approach. Lifestyle, let's talk about lifestyle. The lab work will help us determine, are you going to benefit from a high protein diet or low protein diet? Are you going to benefit more from vigorous exercise, cardio, or more relaxation exercises? And also telling them what are the things you need to do to avoid that are bad for the brain, staying away from toxic things, including relationships, right? That is part of your lifestyle. I mean, like, you know, if you've been in a relationship that's just really bad, and telling them that either, you know, you either cut it off, or you're going to have to figure out a way to not let that relationship, that bad relationship, get the best of you. Sometimes it's good to tell these patients because you empower them. Okay. So let's talk about TMS. By the time the patients come to me, you know, they're already basically treatment resistant. They've seen everybody, nothing works. But going back to genetics, I won't even recommend TMS unless I know what their dopamine status looks like, because I need to know whether I need to support their brain so they'll get the best out of TMS or not. So knowing that, then we can let the patient know, you will benefit from TMS, but I need for you to do A, B, C, D. And of course, we want to stabilize their hormones. Okay. And we're not just talking about, you know, hormonal abnormalities. Okay. So oftentimes, these patients who do have hormonal abnormalities, we talked about it, but they can have psychiatric symptoms: depression, suicide, foggy brain, can't sleep, weight gain. When it comes to weight gain is actually a brain disease. Why? Because it is controlled in the hypothalamus. The MC4R receptor is the one in charge of metabolism. If you have a brain injury and it hits the hypothalamus, guess what? Your own physiology of metabolism does not work. So there are other things we can do to address that, but we need to consider those things. You know, this can benefit the geriatric population, people who are struggling with menopause, andropause, those sorts of things. You will notice that if you stabilize their hormone levels, they will feel better. Their metabolism will work right. Of course, we talked, and then the last thing we talked about is hyperbaric treatment. If all else fails, this is the last thing we do. We do have a protocol in place. We haven't really used it yet because I've actually done a pretty good job at using the first 4, and patients will get to a point where, like, if they're adherent, they're going to get the results that they're looking for. But, you know, I'm not taking off hyperbaric therapy off the table. If the patient can afford that and can have the luxury to do that, I say go for it.